Smile is new age laser vision correction. In this procedure, we don't create a flap on the surface of the eye, and the laser system within 30 seconds does the entire procedure inside the substance of the cornea. We then, through a 2 mm tiny tunnel, just extract a little sliver of corneal tissue, which is called a lenticule. This lenticule is just 25 to 30 microns thick. And by removing this tiny bit of tissue, it changes the power of the eye without a cut. So what's the important thing here is, because we are not cutting a flap on the surface of the eye, we are not cutting thousands of tiny corneal nerves. So after SMILE, the incidence of dryness is much less than LASIK. LASIK has been around for 25 to 30 years, and a lot of patients complained of dryness that took months or sometimes even years to dissipate or go away. This is because we cut all the corneal nerves while creating a flap. In SMILE, we go underneath the superficial nerve plexus, so we don't cut that many corneal nerves as we do with LASIK, which is why after SMILE, people don't have dry eye. Second important thing to understand, that after SMILE, our treatment zone on the cornea, or the area we are treating, is relatively bigger than LASIK. So one of the other bugbears of LASIK was glare at night or halos at night, or an effect called star bursting, where people would see lines of light around street lights and around neon signs. And the incidence of this visual phenomena in SMILE is a lot less than with LASIK, because our effective treatment zone is larger. The third important thing about SMILE versus LASIK is that because we are not cutting the superficial stroma of the cornea, we are destabilizing the cornea less. So after a LASIK, for a large number like -7 or -8, you sometimes end up destabilizing the cornea, and the cornea becomes a little unstable, the number can come back, etc. But after SMILE, the incidence of this happening is much less, because we are not cutting the top part of the cornea to create a flap. And because this SMILE is flapless surgery, the eye heals very much faster. So much so that I have patients who shower the next day and go back to work the next day.